The kidneys do a good job of processing oxalates. That's for sure. But when these oxalates bind to, say, calcium, they can clog up the kidneys and cause kidney stones. They cause crystallization inside the kidneys. So then it becomes a question of, are the oxalates damaging, or are the oxalates plus the calcium in the urine causing a problem?
Welcome back to another episode of the Peak Performance Podcast. Today, I am very excited to have my good friend and the person who has been the guest on this podcast more than anyone else. I think we might be on like your fourth or fifth time now. We have Dr. Chanu Dasari on the line with us. He is a gut health surgeon. He's also a very close friend of mine. And what I love about him is that although he is kind of, I guess, classically trained as a gut health surgeon, he's actually someone who I consider a very holistic doctor, someone who now is actually trying to help people reverse autoimmune disease through improving their gut health and their gut microbiome, like we'll talk about today, I'm sure. But thank you so much for joining us.
Of course, it's a pleasure to be here. And, I hope episode 4 or episode 5, whatever we're on, is our best episode.
Yes, it will be. I have a feeling it will be. Well, let's actually jump right into. So you have a lot of patients that come to you with lots of different issues, whether it be GI issues, autoimmune diseases, all sorts of things like that. What's some of the first steps? So someone comes to you, they have, I'm sure there's different things for different type of issues that people are having, but what's kind of your normal protocol to kind of figure out what the issue is and how you might want to help them solve it?
Yeah, so when I first talk to people, I want to get a sense for their symptoms. Their symptoms are so critical. These symptoms can be inflammatory in nature, some can be non-inflammatory in nature, and really trying to figure out which ones belong in each category to me is a very important thing. An example could be somebody comes in for dry eye. Well, if the dry eye happens at random times or after certain foods, or in response to certain stimuli, maybe it's not so much dry eye, maybe it's an inflammatory response. Same could be true for fatigue, same could be true for brain fog. Joint pain is another big one, lower back pain, even bloating, right? Intestinal bloating. If it's like a one-off sort of situation, fine. But if it's happening every night and people look like they're pregnant at the end of the night, or they're having really a lot of trouble with pressure in the abdomen and things like that, that's not normal. I would categorize a lot of these a lot of these symptoms, the ones that are related to global inflammation, they fall into this giant bucket of gut microbiome dysfunction. And I say it with that definitive of a description because there's only so many variables that affect gut microbiome dysfunction. They are diet, digestion, sleep, stress, and exercise. All the other factors that are involved with inflammation are way below that. So other examples could be heavy metals, or it could be like viruses or old viruses like EBV or CMV or Lyme even, right? And I would tell you that a lot of people get hung up on these minor factors when they're like looking into things and when they're trying to solve problems. But the reality is the biggest factors are the ones staring you right in the face. It's the things you're eating every day. It's what is inside of your abdomen every day, right? The bacteria, the microbes. It's how much sleep you're getting, how much stress you have, right? It's the day-to-day factors that are actionable and can be fixed that hold the most weight in terms of swaying the inflammation. So when I'm talking to a patient, I want to get a sense for what are their symptoms, what is their lifestyle, what are they doing currently, and I take a very detailed history. Sometimes these appointments last several hours because we're going through every little detail. We're reviewing every single laboratory that they've ever had. We're reviewing all the clinic notes, and it's to really get a sense for what got missed, what are some room for improvement, what can we do to solve this problem. The goal is always to reverse this inflammation so that within 6 weeks 50%, 80%, 100% of the symptoms are gone. We don't wait long periods of time to see a result. We want to see the result pretty fast.
Yeah, yeah, that makes a lot of sense, and I'm sure a lot of people here have dealt with, especially the bloating, and I'm sure many of the other issues. So then, what is it that you're? Yeah, so now you're kind of asking questions. You're looking at their history. Are there any tests that you kind of like are always, whether it be, again, the stool test, the biomes, and the other kind of ones like that, or I know you're looking at blood work and things like that. Are there any tests that you like are kind of your go-to tests when people come to you?
Yeah, let me actually answer your first question about these stool tests, because there's a very important thing that I want folks to know here. It's that there's a lot of different stool tests, right? You have the Viome test, you have the Mosaic test, you have the Genova test. These are all tests that basically test your stool to see what type of bacteria, what type of funguses, what type of parasites are inside there. It turns out that most of these tests, assuming you don't find something staring at you in the face, like assuming you don't have E. coli or salmonella or clostridium, something so basic that you need an antibiotic for some of these more subtle imbalances, I'm talking about a high firmicutes or a low bifido or a low lactobacillus. These are very subtle findings that show up abnormal on these tests all the time, even if you take these tests on normal individuals. So now, if you take these tests on someone that is, say, having a chronic inflammatory reaction or an autoimmune reaction or a gut health reaction, what are the chances that in a diseased population that these tests will be abnormal? Probably nearly 100%, because even in normal people, even if you were to take one right now or I took one right now, it would be abnormal. So what ends up happening is you get an abnormal test result from a gut microbiome test. Then you automatically correlate it with the symptoms, and then you're now pursuing interventions to try to fix that problem, which may have been a red herring, okay, may not have been the actual issue. But moreover, some of these companies like Viome, and I really like the company for what they are intending to do, but they'll send you some probiotics to try to fix this problem. And the sad thing about it is, obviously I'm not seeing a lot of people who are succeeding, otherwise they wouldn't be calling me. So I'm only seeing the people that are failing these modalities, right? So they are taking these probiotics, not really seeing a difference or not seeing a noticeable difference. And then they're wondering, well, what am I missing? Well, the thing that you're missing is that original test, it was not testing for the DNA inside the bacteria. It was just testing for the species. The DNA inside the bacteria, there's even subspecies names attached to them, like bifido, for example, bifido longa. There's probably 100 or 200 different strains that I know about, and each one of those substrains have its own genetic code, and each one of those genetic codes code for different things. For example, some lower histamine. Other ones will deconjugate bile and cause cholesterol to go down. Some of them will process carbohydrates and fructose a little bit better. So, not even within the same species of bacteria, you have hundreds, if not thousands, of different functions of each little DNA strains that are not tested for currently in these tests. And this is why when people ask me, is it valuable, is it helpful to have a microbiome test up front? I tell them in most cases it's not, unless you find something glaring in your face, like H. pylori, candida, or possibly even Clostridium, E. coli, salmonella. But if you're looking for more subtle imbalances that cause the other 95% of autoimmune disease, you will not find the right answers with the gut microbiome test.
Mm, that's good
But
to know.
but okay, and then your second question, right, was what tests do I order? Well, obviously they're the basic tests. In terms of functional health tests, I actually like food sensitivity tests somewhat, and I know that it's a big debatable topic because it's not accurate. Like most of the food sensitivity tests are totally not accurate. There are four different types of tests. There's a skin prick test. That's when you go to your traditional allergist office and they tell you, hey, which one do you actually have an allergic reaction to? And that's an IgE type skin test. They also have IgE blood tests. These are allergy blood tests that check for immunoglobulin E, which implies an allergic reaction to certain foods. but the panels are pretty small, right? They only check for about 20 or 30 different items. There's not all these expanded panels. There's also IgG food tests. Mosaic is one of the most famous IgG4 food tests. There's different companies out there that do those. And that will check for sensitivities more so than allergies. And the sensitivities are sometimes accurate and sometimes not accurate. For example, let's say you ate something the day before the test. Let's say that the test shows that it's borderline, but you had no reaction to it. Does it mean you're actually sensitive or not? Well, it turns out the test itself is affected by your exposure. So you can get false positives and false negatives based on how much you were recently exposed to that item, turns out, right? And then there's another layer to this, or there's another test that I happen to really like. Then this is the test I order the most frequently. It's called the LEAP MRT. It will actually check to see what happens to your white blood cells. Because when a white blood cell comes up to an antigen and then it degranulates, it loses all its contents and becomes really small. And they will measure the size of the white blood cell before and after it comes into contact with a specific antigen and food. And that change in the white blood cell will tell you if there's a sensitivity or not. I really, really like this test. Again, there are also false positives and false negatives, just like any other test. But I like the modality of it because it seems like a more functional test, and I get a lot of accurate results with it. But you want to know what? You want to know what the best test is, Talor? And I hate to say it, it's a food diary. It's like an
Interesting.
analog notebook food diary, stuff you write down every single day along with your symptoms. Because even if you do all of these tests and you spend your hundreds or thousands of dollars doing all these tests, at the end of the day, you're still going to have to keep a food diary and you're still going to have to figure out the foods that are actually causing a problem and not.
Interesting. So you would say, hey, write down everything you eat, and then every day, what, rate yourself how you feel or something like that at the end of the day, or what's the mechanics of the food diary?
Oh, you've just hit it right on the head, Talur. That's exactly what we do. We want every single detail. We want every single food that was eaten during the day, including the amounts and the times. We want what you were feeling, when you were feeling it, in comparison of your symptoms day to day. We want to see pictures of the poop. We look at stool pictures every single day. We
All right,
track.
not to get too graphic here, but what are you looking for? What are you looking for? I'm so curious.
So a couple things, right? I want to see. So the obvious things are blood, mucus that would imply some type of really bad inflammatory issue. Okay, fine. Not everybody has those unless you're dealing with inflammatory bowel disease like ulcerative colitis or Crohn's disease. So what about if you have general autoimmune disease? Well, I'm looking at the texture of the stool, the water content of the stool, the fiber content of the stool, and the general appearance. It turns out if you take and we'll go into this when I explain the process of how we get people better, but we put people through this recalibration phase where we change the makeup of their microbiome within several weeks. And when their microbiome changes, there is a visual change that corresponds to that in the stool. I want to be able to see when that change took place. And when that change does take place, you can basically set a timer for when somebody gets better. You can set a timer for when their abdominal symptoms get better, their joint pain gets better, their brain fog gets better based on the appearance of the stool. And this is why I spend so much time looking at poop pictures because it's valuable information, right? And if you pair that with, like, say, a food diary and a symptom diary, and you give people feedback every single day, you can see how powerful that approach would be to fix these problems, right? It's not, you don't let these problems keep going and fester for months or years. You fix them right away, and then it's no longer a problem.
Mm. That's going to have to be the soundbite for this episode, and that's why I spend so much time looking at poop pictures. That's actually hilarious. So wait, maybe
If you
just.
looked at my cell phone right now, you would be.
Oh no.
I will tell you, in the last 24 hours, I've gotten at least 100 photos, new photos.
Oh man, this is amazing. So real quick, just for the general public here, us who don't know even what a healthy stool or unhealthy stool looks like, what are there some general kind of principles here that, like, okay, this is a red flag, that's a red flag. Obviously, I mean, look, sometimes it's going to be softer than others or something, but what's the kind of the red flags, I guess, maybe?
First of all, I love talking about poop. I could do this. I could do this all day long. Let me tell you what they taught me in medical school, and then let me tell you what I know from doing what I do, because the answer is different. Okay, the traditional teaching was that your stool should look like soft serve ice cream. So if you could imagine it all coming out in one piece, right? And it's not really bulky or hard, it's sort of very smooth, but still intact, right? And it just kind of comes out smooth. So that's what medical school taught us. And by the way, there's ways you can rank the stool. There's all these like outdated research methodologies of how you can describe stool based on the appearance. I don't actually buy into any of that. In my practice, however, here's what I look for. I want something that looks like loose potting soil that is slightly green in appearance, without mucus, without blood, and sufficient amounts of water and fiber. And the water and fiber you can really tell it really looks like loose potting soil. Again, I'm not going to show you the photos on my phone. I've got probably 10 I could show you that look perfect, the perfect poop, right? But I've got plenty of or not photos, but descriptions on my website about what you can expect. And but I'll tell you, when the stool does turn into a perfect poop, people's lives improve. Like their symptoms get better. They're, they get so much energy, and they're so surprised, and they're like, wow, if I knew it was only this simple, right? That you fix the poop and you fix my symptoms, this is amazing. And then they go tell all their friends about it, and their friends do it and they get better. And it's just like such a great feeling, and everybody's talking about their poop with me. It's like I guess that's what I do right now. But yeah.
That's great.
So to answer your question, you're looking for the absence of blood and mucus. You're looking for actually an irregular border that looks almost like a loose potting soil. You're looking for something that may have a slight green appearance or at least a lighter brown appearance. And you're looking for one that's not very smooth contoured, that would imply like hard pebbles and things like that. That's really what you're looking for. And I'll tell you, frequency, right? You want ideally 1, 2, 3 a day, right? And if you're going multiple days without stools, or let's say you're only having a half a stool a day, because that happens. People say they go every day, but they're not emptying every day. And you can
Mm.
tell. You look at the stool and it's like, that's not a stool. That's like a pretend little, half a half. Like, where's the rest? Where's the rest? But
So what? Yeah, I mean, I think that's a big problem too, for people who, because like, yeah, you hear sometimes people like, going multiple days or every other day or whatever, and it's like, wow, that's actually that could be an issue. So in that case, if someone is not regular every day, is that just a case of adding more fiber, or what's kind of the advice there?
So, decreased stool transit time, slow stool transit time. There are so many ways to fix this problem. I think, in a very basic level, you need to edit the diet. So, there's a lot of actually green powders and or supplements you can take with not only psyllium husk but also fermentable fiber. So, fermentable fiber would be things like, something like a chocho protein, or possibly even a, oat bran, something like that. Lentil fiber, right? So some people have problems with fermentable fiber, so they do better with, say, psyllium, and there are also other better forms of fiber too. That you've got actually quite a few products with fiber in it. I appreciate that. Thank you. but but that helps, right? Is like having fiber, okay? Having sufficient amounts of water would be the second thing. The third thing is having the right population of bacteria. So there's this big misconception in the world of SIBO, right? That people think SIBO causes constipation. And it's like the other way around. The constipation is what causes the SIBO. So like, let's say you don't go for a day. What do you think happens? The same food ferments, not for 12 hours, not for 24 hours, but for 48 hours. So food that would normally ferment like maybe once or twice is now fermenting like 8 to 10 times. So the population of bacteria is changing that entire time. This is why you get bacterial overgrowth. It's because you have decreased stool transit, not the other way around. Okay. So the other variable for the stool transit is what type of bacteria you have, because once you have an accumulation of these kind of pro-inflammatory bacteria, it turns out the stool just wants to stay there. And then it becomes a race where you're taking stool softeners, right? You're taking supplements to try to get you to go, really, and have the bowel movements. And really, that is what's needed in for people that don't go every day and they've tried everything else.
Interesting. Interesting. So then now a lot of people may be thinking like, okay, so what are the common things, I guess, maybe that you see that are ruining people's gut health, that are kind of like easy fixes? Like when you're like, oh, okay, this person's eating way too much, fill in the blank.
These people are eating, okay. A lot of people cannot tolerate this product that I'm about to talk about. And I don't sell it, so I've got no dog in this fight, okay? Is
Hmm.
chocho protein, okay?
Never heard of this.
Chocho,
Okay,
yeah.
I got to hear more.
Chocho protein is like a lupini bean from the Andes Mountains, and they basically make it into a powder, right? And this protein is fermentable fiber plus protein with zero net carbs, no heavy metals. It's got all nine essential, it's got all of
Aminos.
these,
Hmm.
yeah, all the essential aminos. And the cool thing about it is, if I could pick one thing to go travel with, or one thing to, like, if I was on a desert island and I had to fix my gut health, that'd be the one thing I would take with me, because it's
Wow.
got the protein, it's got the fermentable fiber. And so every other thing that you do, yeah, maybe you have a little fat during the day, maybe you'll have maybe a carb or two here or there, but at least you got the most important basics covered. And I told you there's a caveat to this, right? Because not everyone can tolerate fermentable fiber. So there are a subset of people who will have this fermentable fiber, and because their microbiomes are so wrecked, like they have trouble fermenting certain types of foods, it will be the wrong choice for them. And
Hmm.
so I say this with a grain of salt that, yes, it's in my view, in my world, it's the gold standard. If you can get to that, you've won the game. But I will also say that in some people, I would say maybe 5 to 10% of people, they have a rough time with that fermentation process, and it's kind of a violent process getting them adjusted to this new protein powder.
Spell that again. What was it called?
Yeah, so there's different ways to spell it, but chocho, CHO. They also call it tarwi, TARWI. They also call it the Andean lupine, so the Andean lupine bean. Um, there's two other names for it. I'm really forgetting because it's very regional specific. Like, depending on where you go, people call it different things. But
Okay, I think
yeah,
we got a few different names. I'm sure we can find
sure.
it. I like
Yeah.
that. I'm going to be looking into this one. Hey, it sounds interesting. If you're recommending this one as one of your top choices, that's impressive. And it's always interesting because you hear so many people who talk about, and again, maybe this is based on the individual person, but people who are saying, oh, beans and legumes are really bad for your gut, right? There used
Oh
to be
yeah.
the old, yeah. So
Well, no,
but
it's
you
still
tend to
true.
recommend different beans, right? So tell us what's your opinion on that.
Talor, I'm telling you, this is a very now you're getting into the nitty gritty on this. I would love to talk about this. Let's talk about it. So there are some people who react violently to beans, legumes, lentils, chickpeas, chocho powder, right? The universal truth of all of these people is they have problems with fermentation. Okay, these foods are inherently higher in lectins, and thankfully, chocho doesn't have lectins, but it still has fermentable fiber. So even if you don't have a lectin problem, you might have a problem with a fermentation. So when you process these foods, when you eat these foods, there are so many critical items. First, you have to soak them, sometimes overnight, sometimes over 2 days. And I would determine how you soak them based on the size of what you're cooking. So let me give you an example. If we're thinking about chickpeas are very large. I would soak those for 24 to 48 hours. If you're looking at a black bean or a kidney bean, right? These things contain solanine alkaloids, they contain lectins. I would soak them for at least overnight, 24 hours, or sorry, 12 hours on those. And if you're looking at like lentils, for example, if you're looking at red lentils, which are really small, you can get away with a 4 hour soak. If you're looking at a larger lentil, say a yellow lentil, black lentil, or green lentil, you're looking at an overnight 12-hour soak. Okay.
Mm,
Once you soak them, then you pressure cook them. Once you pressure cook them, all the lectins are removed when you pressure cook. And this is what nobody ever talks about, is how to remove lectins from food, because it's based on how you cook and how you prepare the food. You put it in the pressure cooker, and then you cook it based on the size of what you're cooking. So let's say the chickpea, you're going to cook that for 45 minutes. Those beans you're going to cook for 30 to 35 minutes. The red lentils you might only need 15, right?
mm,
And then try it out. Then try and see if you can process, if you can truly eat that food. Because then if you've done all those steps and you still have a problem, then you probably have an issue with fermentation. But if you don't have a problem, guess what? You've now expanded your food choices and you are having a lot of healthy foods, and you're avoiding all of those big doom and gloom scenarios that all these people talk about as being beans and legumes and anti-nutrients, and all of those things are totally avoided, and people don't want to talk about it. People don't want to talk about food preparation methods and how to avoid these things. They just want to exclude large categories of food. That's what they want to do.
yeah, that makes a lot of sense. That makes a lot of sense. What other foods? What are some of your other favorite foods for gut health?
So another really good way of getting calories in general is omega oils. And the reason I say this is it's a very neutral food, meaning it doesn't feed bacteria because it's a fat. It's not a sugar. It's not a fiber. It doesn't feed the bacteria. So it's an easy way to get calories. And it's especially good for people that have dysfunctional microbiomes. So, like, let's say you have the bloating. Let's say you have problems with fermentation. What is the safest food you could eat? The safest food is actually an omega fat, because it's not going to be processed by any of the gut microbiome. You will not see wild shifts in the microbiome as a result of it. And guess what? For every gram of fat, you get 9 calories. It's the densest food in terms of caloric intake. So now it becomes a question of what type of fat do you want to do? Do you want to do saturated fat? Do you want and by the way, the ranking goes as follows: monounsaturated omega fats are at the top. Those are the best kind of fats. The second I would put under that would be saturated fats, maybe MCTs in there. The
So the
third would be
monounsaturated, that would be like your olive oils, right?
your olive oils, your avocado oils,
Yep.
your almond oils, your flax oils, walnut milk. A lot of these very, very healthy oils would be at the pinnacle, at the top. And again, just to clarify, you are not heating these oils; you're eating them raw. Because if you heat these oils, they will denature and turn into an unhealthy oil. The second best would be a saturated fat. And saturated fats, these are like your ghees, your butters, your nuts. And you can actually cook with these oils somewhat because they don't denature as easily. However, let's not kid ourselves, they're not as healthy as the omega fats. I mean, the data is very clear on that. Okay. And then below that is the unsaturated fats, the trans fats, the seed oils, so to speak. And you shouldn't be heating those at all, because they'll turn into trans fats and cause they'll cause nothing but problems in your body. So yeah, I would tell you omega fats, raw, like
And
raw,
when you say
unheated.
omega fats, people may be thinking fish oil when you say
Fish
omega
oil is
fats,
great
because
too.
yeah,
Fish oil falls into that category too. Fish oil is a omega 3 fatty acid. It's a great
yep,
example. Very healthy.
yep, yep. And then on the topic of seed oils, right? Like, I don't know. I feel like I can feel it in my gut when I consume seed oils. Maybe I'm very sensitive to it, but and I know obviously it's worse when they're being cooked at high heats, right? You definitely don't want to be doing that, which is why I think French fries could possibly be the worst possible food, or at least up there. Some sort of fried something in seed oils, I would imagine is up there.
Hmm.
But what about the fact that like 95 or maybe 99% of the salad dressings on the shelves in supermarkets have seed oils. Every, cracker, bread, you name it. I mean, probably you walk down the supermarket aisle and over 90% of stuff probably has seed oils in it. So let's take an example of something where people are like, oh, salad dressing. I'm going to have a salad for dinner today, and I'm going to have this salad dressing. It's even a low calorie. Look, it's the bottle looks healthy, but it has a bunch of seed oils in there. Have you seen that be an issue, even if they're not heated highly? Or do you think people can, in general, get away with that? Is it something we need to go crazy about?
In the United States, we're the only country that allows these types of things to creep into our food. And we're one of the only countries where you can take an otherwise very healthy item and turn it into something totally unhealthy because there's some company that wants to cut corners and make a profit and put it in a supermarket shelf. Perfect example of this is hummus, right? Most of the hummus you buy, when's the last time you've actually seen genuine estate olive oil in a commercially bought hummus? It's all got canola oil or some other oil that you don't want, or like it's got all this processed crap in it, citric acid, all kinds of weird stuff. Okay. Same with salad dressings. They the corporations, these places that sell these items, they have a choice. They can use a higher quality item, but it does increase the cost. The cost is frequently passed down to consumers. Some consumers are not willing to pay that cost, so then they create these quote unquote cheaper mass production alternatives, and that's what we see in the store shelves. And I would tell you that there's a lot more choices today than there were even 2 decades ago. People are getting a lot more savvy about where they buy things, how what are they looking at on the labels. But I would tell you, yeah, it's a huge problem. You could be eating something you think is healthy, but turns out it's got all this garbage in it, and then yeah, you're shooting yourself in the foot.
Yep. Yep. What's your do you have any opinion on, there's a lot of talk about oxalates and people eating raw spinach and raw kale salads thinking that it's fine, and maybe it is fine for many people. I'm curious kind of your opinion on like things that may be potentially high in oxalates. Have you seen that cause any issues for people at all?
I would love to talk about oxalates. Let me give you the rundown. So
Nice.
oxalates are important because of kidney health. Oxalates have a tough time getting filtered through the kidneys in an effective way. The kidneys do a good job of processing oxalates. That's for sure. But when these oxalates bind to, say, calcium, they can clog up the kidneys and cause kidney stones. They cause crystallization inside the kidneys. So then it becomes a question of, are the oxalates damaging, or are the oxalates plus the calcium in the urine causing a problem? And really the answer is the oxalates plus the calcium. Okay. So now let's have a discussion about the calcium for just a second. Why is there calcium precipitating in the urine? It turns out the primary cause of that is actually vitamin D deficiency and magnesium deficiency. So let's say you're taking a vitamin D. Let's say you're not taking it with magnesium. That will drive up the calcium in your bloodstream temporarily, and your kidneys may filter that out. And let's say you eat a piece of, I don't know, spinach with oxalates in it. And let's say you have a history of forming calcium oxalate crystals in your kidney, then you'll cause a kidney problem, right? But let's say that same person is smart, takes some vitamin D, takes some magnesium, right? Maybe even some K2. And then let's say they do this for a sustained period of time, right? Let's say they do it for months and months and months. Let's say they're eating tons of high oxalate foods during that time. The oxalates will very easily filter out of the kidneys, causing zero problems, will cause no issues in terms of GFR or any type of internal organ damage. In fact, the phytonutrients from the vegetables and from these green leafy vegetables will actually cause these organs to heal and reverse damage. So here
Wow.
you've taken something that, the boogeyman said, or someone on the TV said was a big bad thing, and you fix the actual variable that causes it to be a problem, for example, the vitamin D and the magnesium. And then now you've now converted it into a very helpful asset for your health. And the same could be, a very similar theme here is the lectins, right? I've told you, I described to you the process of getting rid of lectins in food. And so, if you can follow some of these methodologies and educate yourself about how these things actually cause problems and fix those problems in not so much a reactionary way, but a more educated way. And this is what I educate every single one of my patients on. This is why it takes, people are watching like 15 videos on how to reverse autoimmune disease naturally. They learn about all of these topics. It's all in there. I've described nothing new in this podcast. You're just getting a preview of what's in the Mind Gut Immunity Clinic program. And we get people better within 6 weeks. People are, I mean, I'm talking full blown autoimmune, Crohn's, colitis, lupus, rheumatoid, psoriasis, just you name it, MS, right? And we're getting these folks better in such a short period of time. We're doing it by educating them on all of these very, very important topics.
That's awesome, man. Yeah, I want to ask you any kind of final thoughts. I know we're going to wrap up. Any other final pieces of advice? And then, yeah, I would love for you to tell people where they can potentially learn more, especially if they or someone they love has an autoimmune disease or some issue that they've been struggling with. Because man, so many people that struggle with these things, when you go to traditional doctors, and then you get one prescription and another prescription and a wrong diagnosis or someone, I really hope people listen and seek your advice and try to take this route where, they can kind of heal themselves holistically. So yeah, any kind of final words of advice here for people with regards to gut health, and then please let people know where they can follow you and find you.
Yeah, here's my best advice. There was a time where everything was normal in your life. You were not looking over your shoulder for everything you ate. You were not wondering when the next symptom was coming at you. You were not wondering if your day was going to be good, bad, or ugly. There was a time when you were healthy, when you weren't worrying about all these things and you were a normal person. And guess what? Your genetics were the same then as they are now. Most of the time, the things that change are the things that are inside of our gut. So we're talking about diet, we're talking about digestion, we're talking about the microbiome. These problems are problems that can be fixed, but you need the right expertise and the right knowledge in order to fix them. Otherwise, you get in this situation where you will go see some doctors and they'll prescribe you medication because the underlying problem, they don't have any expertise in how to fix it. There's very few people, in fact, that do the kind of work that I do to the detail and diligence that I do it. And it really takes somebody with this level of understanding. I would tell you, it takes somebody who cares about their health to seek me out. It takes somebody who really cares about knowing the details and getting down to the nitty gritty, actually wanting to recalibrate their gut microbiome in order to have an anti inflammatory metabolome, as opposed to constantly worrying about what the next thing could bring or what the next issue could be. And that's my parting advice. I think if you're stuck in a situation where you're dealing with a gut health issue and or you're dealing with inflammation and you're trying to do it yourself, by all means, I would try to incorporate as much knowledge as you can. I would try to seek out experts in this area. I would try to listen to a lot, podcasts, get educated. I also offer discovery calls if you want to just chit chat with me for a few minutes. It's very affordable, and they can just find it on my website at mgiclinic.com. And I could just talk to them about, just different issues. I can give them some ideas on those calls. Whether or not you'd end up deciding to join the program, also fine. At least you'll come away with a sense of understanding of where you need to put your energy and attention. And I think that's the true value, is just knowing that there is a way out and that there is expertise and where to find it and where to find this knowledge. And there's a lot of power in being educated and being knowledgeable, and it's all for people's health, and that's what I'm here for.
That's amazing, man. Man, we've hung out a bunch of times. We've had a few podcast episodes, and yet, kind of most of what we spoke about here today was new information for me as well. And I know I absolutely loved it and enjoyed it and learned a lot. Was kind of taking notes on the side here, scribbling some stuff down. So I really appreciate it, man. I really, really appreciate everything that you're doing. You genuinely want to help people. You're a surgeon who tries to help people avoid surgery, which I think is just awesome. I wish there were more surgeons like that. And yeah, highly, highly, highly recommend people take you up on that offer of that discovery call, mgiclinic.com. And yeah, anything else, any socials or anything else you want to shout out?
No, I mean, you know where to find me. I'm, Dasari MD. You might hear my daughter. She just walked in. So this podcast is done. I appreciate that. And we'll chat with you soon. There we
Sounds
go.
great, man. Thanks so much.
All right. Take care.
Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.